really hot, it's going to be as effective. If it's whiter or if it's pinker, it doesn't make any difference.
Is it possible for the product to be too rich for the skin? Why do people sometimes have red spots after using it?
Good question. It's a live product. It's talking to your cells. If you have some issue in that area, those cytokines or interleukins or whatever process is going on in your skin is interacting with Luminesce, and Luminesce is trying to heal it. That's what it's trying to do. It's trying to tell your cells to heal it. So sometimes one of the ways your body heals is creates an inflammatory reaction to something that it doesn't like over there. So maybe you have a micro-infection there, or maybe you have something else going on that you can't see it so much, but once you put it on, it reacts to it. But it should go away. If you have noticed that it stays on and it keeps red, then it's not the norm, because I haven't seen that. But if you get a little bit of redness, sometimes in blotches, it's probably just that reaction. I have never seen anybody in my practice who's used it who's had this redness. So if you have specific people who have it, then I would like to know.
Is it expected that there might be any side effects or negative indications from using Luminesce?
It's the most natural product out there. It's as close as you can get to taking your own stem cells and putting it on. So the side effects are basically how your body reacts to the cells. Hypothetically, you can have, reactions to anything you put on your skin. But in general, because it's such a natural product, I have not seen one person in my practice who's had a reaction to it. I've heard that some people have had some redness or some reactions, but again, it may be a reaction to something else that they're putting on their skin, and that's what I haven't tried. I'm still trying to figure out if that's what's happening, but I've never seen an allergic reaction to it. I've never seen anybody get any problems with putting it on. Hypothetically, anybody can get allergic to anything. Anybody can have problems with any sort of topical cream, but it's very unlikely with this product.
Sometimes when I watch infomercials on television, some products seem to promise immediate results. That seems too good to be true. In your medical opinion, what is the time that people are using Luminesce that they should expect to see some benefit?
Good question. Actually, there are products that give you immediate results. They're just topical. They're not in the skin. Okay? So they put on a cream, and the product is made so that it will tighten up the skin right away. But once you wash it off, it goes away, or after a few hours, it goes away. The effect is not in the skin, it's on the skin. The difference here is we're affecting in the skin. We're going with Luminesce into the cells. We're going into the skin. So it takes time for everything to happen in your body. Nothing happens right away. I've had people see improvement in their skin within 1 or 2 weeks, and I've had people using it for months and months, and they keep getting better and better. The reason is it takes 3 months for collagen regeneration. So from the time you put it on, it's going to take 3 months for you to get new collagen. That's just your body. Nobody's going to change that. No cream, no dermatologist, no laser, that's us. We cannot change nature. So when you're seeing the changes right away, or you're seeing changes more immediate, they're the topical changes. They're the things that the rest of your cells are doing. It's the turnover of the cells that are changing. And that can happen within a week, because the turnover of the cells is about a week. So when you go to the deeper layers, to the more permanent changes, the more long-lasting results, is going to take 3 months. So that's really, you want to test something for the skin, for the